I'm here with Jo. She's about a year out from a revision scoliosis surgery. She came in to us from out of state after having had a procedure at another hospital and was really not doing well. She was previously working as a flight attendant, was to the point where she really wasn't able to do her job duties. So we'll kind of catch up and see what the experience was like and how she's doing now.
Okay.
So fill us in. How's work? How's stuff going?
Work is great. I have learned to work around my back. I don't put a lot of pressure on different areas of it, but as far as this surgery, the recovery was much faster because I knew what to look for, and I had your excellent staff helping me. Baby steps on everything I've done. I've listened to everything you said, the Pilates and the muscle building and the lower legs and all of that has really helped me. And of course you have. I don't have anywhere near. When I saw you a year ago, I was in agony. And now I have good days, bad days, almost always good days. So.
Especially if you're doing high demand work, you're working full time as a flight attendant. Out of curiosity, for people who had surgery, how do you know something was wrong? Can you fill us in on what was going on? You were a couple of years out from surgery. You had a period where you're doing okay, and then kind of what happened?
I honestly don't know that I ever had the okay. I still kind of hurt. And then probably 6 months before I actually felt the snapping, I had not been feeling good. The lower pain seemed to be more bad days than good days. And one day I actually bent over and heard a loud pop. The loud pop. So from there, I freaked out. I talked to my trainer. He said, oh, maybe it was a glute muscle. And 2 weeks later, it was not getting any better. And he said, Jo, you need to call your surgeon, which I called my old surgeon. And they said, there's no way. It can't be the rods. If this doesn't get any better, you need to see your family doctor. So 2 weeks from then, I saw my family doctor. He had me move my legs all around. He said, this is not your hips. You need an x-ray. So there from the x-ray, the next day they called and they said, your rods are both broken in the lower area. And from there, I started doing my research for a revision specialist, and your name kept coming up. So it was worth it for me to come to Texas because I don't want to have another surgery.
Right. And the popping, that you heard is really the rods breaking. And it's important to remember when we do scoliosis surgery, the surgery is not the installation of metal. So the surgery is really a fusion. The metal is like a cast that we put on the bones to hold them still and straight. If you don't heal properly, the metal is not living tissue like our bones. So eventually, just like having a paper clip that you bend a bunch of times, it turns white and gives out. It's the same with the metal. And typically, if you don't heal properly from a surgery, usually between 2 and 5 years, something will give. Either the screws will get loose in the bone, or the metal itself will break. And sometimes if the metal breaks, you hear a loud pop. For us, what we really are interested in, we see all our scoliosis patients for at least 5 years out from surgery. And what we're looking for is that you're doing well and everything looks the same. The first sign that there may be a problem is actually not the metal breaking. So usually what we look for is at the year after surgery mark, which is your visit today, that people are not having lots of back pain, they're doing everything normally. If you're not doing well, then it raises our radar a lot and we think, wait a minute, is she really healed? Because you shouldn't be hurting a lot. So most of my patients at a year out from surgery, they're back to doing all their normal activities of daily living without restrictions, they're working full time, they're doing all the things you're doing. If you're not in that boat like before where you never quite felt right and then finally the rods gave out, we usually can tell if you're not healed at a year just because you don't look like our other patients and you're having trouble with back pain, these kinds of things. The big difference in scoliosis surgery in adults and kids is actually not our technique or the metal we use. The challenge is adults are a little bit harder to get to heal, and we virtually never see one of our children not heal a scoliosis fusion, whereas about 3% of the adult patients who have big scoliosis surgeries may have a spot that needs to be rebone grafted at some point. So it's something for our follow-ups, we really like to see people for a minimum of 5 years because we want you to do well and want to make sure you keep doing well long term.
Right.
Anything you're not doing now, activity-wise with husband, work, stuff that you're looking to get back to, or you feel like you're pretty much there?
I'm pretty much there. I'm trying to do a little bit of running. I know I'm not supposed to, but I'm a light jogger and I'm doing a minute here and there. I feel like I have my life back after this surgery. That first surgery, I did not do my research. I thought it was just a simple surgery. You come in, you come out, and you're fixed, and you're not. Especially at this age, you're right. You're dealing with the mental. Those kids, I've talked to some different girls,
Right.
because you can see their scar, and I'll say something to them. They're young. They don't know any better. They get out. They start doing everything. Their bodies are not 50 years old, and you take someone who's set mentally and physically, and that body's fighting you every inch of the way, putting that metal in and all of that surgery. And so I think that the mindset, an excellent surgeon, and then you have to continue to take care of your body. You have to. This is going to be in my back forever, so I have to keep the rest of me strong.
Yeah, we have a big pediatric practice. I mean, we see it because we have a lot of children who have surgery. We have a lot of adults. I mean, ultimately, at a year, both groups do fantastic, but it's important for our adult patients to really get you guys in good shape before surgery. We worry more about complications in adult patients. We want to really optimize you both physically, mentally, medically, to make sure we get you through the surgery safely. And then if, like in your case, you have something that doesn't heal, then we want to figure out, look, what's the safest way to get this to work? We don't want to have somebody keep having surgeries and breaking rods every couple of years. So in your case, it was actually putting some bone graft on the front part of the spine to make sure that the bottom of your back healed to the tailbone. But it's different for every patient. It depends where the surgeries have a problem. And oftentimes, if you've had a big scoliosis surgery and you're really not doing well, something is usually going on. So it's just a question of figuring out what it is. You made it really easy because you came in with both your rods broken,
Right,
so
right.
it didn't take a lot of thought to figure out the problem.
But I'm going to give you kudos on this, because you listened to all of it. You didn't just look at the broken rods. I told you that I was having issues with this shoulder. So then you decided to not only do the lower, but to open and tighten and get, and you actually were able to take a little bit of my rod out because the shoulder was still pulling forward. So you didn't only just fix one problem, you fixed, as far as I'm concerned, everything. I have a lot more flexibility, a lot more. So if you would have just fixed that without taking the time to really get to know me as a patient and where my hurts were, you went above and beyond.
And that's certainly, if we're going to put you to sleep and open you back up, we want to fix everything.
Right.
So, in her case, the upper part of her fusion was healed well, and she was struggling with some prominent implants. So the screws up at the upper portion of her incision were kind of interfering with her shoulder blade function a little bit. And when we looked at it, it looked healed, so we were able to take some of the upper implants out, even though the lower part wasn't healed. And once those were out, then the shoulder stuff improved right away. So
Absolutely. So you fixed the whole thing without even realizing.
So we'll, at this point, not that we still love you lots, but we'll start seeing less of
That's
you.
okay. That's good. That's
So
a
we
good
usually
thing.
will check you, every year to 18 months till
Okay.
you're at least 5 years out. I mean, with the caveat that if any time you have problems, we'd rather know about it right away.
Yes.
So don't assume just because you're doing great, we said it's a year. If all of a sudden you're struggling, give us a buzz, we'll check it immediately. But honestly, most of our patients who make it to the year mark and are doing well, you're fixed. So before, you took a while to break your rods, but you weren't doing well at the year mark, right? So that
Honestly, I don't think so. I did not go back to work. I mean, at 10 months, I still wasn't at
Right.
work. No. But again, you take your office gives us a ton of information. It's not just a surgery, it is a lifestyle change. And you say about doing the Pilates, you say about this or that. Some surgeons just fix you and let you go. So the back was obviously a problem, but then you took someone who was perfectly healthy, and I wasn't doing anything except for walking. So I'm sure there was tons of muscle atrophy in the hips, in the shoulder, and everything. And your office makes it all work together. It's not just your back.
It's also hard to rehab you. If you're not doing well and something's painful, it makes properly rehabbing you very difficult, because if you start pushing it, then it hurts and you're wrecked. For us, it's just trying to figure out, when we look at people that are having problems from a surgery, one of the most sensitive things is actually some of the research questionnaires. So when we look at people who are a year out from surgery, we understand in terms of improvement where they should be. When we've done a couple studies looking at this, the first thing that shows up for non-unions like you had well before the rods break is people start looking different at a year. They do not look right. They don't look as good. They're not doing what they should be doing. They're limited. And that usually raises our suspicions that, wait a minute, you don't look like the other 90% of our patients. Something's not right. So that would prompt us a lot of times to get a CAT scan, really check the fusion early, instead of waiting till 2 years or 2.5 years where maybe it becomes obvious. So I think for you, the frustrating part is, I think in a year you probably could have figured out you weren't healed. And when you weren't doing well, getting a CAT scan early can be helpful to sort of figure out, look, is the fusion solid? Ultimately, you declared yourself because the rods broke, but we lost sort of a year there where nobody could quite put their finger on why you weren't doing well. Like I said, they're sending your primary care and all these other things, but really probably the whole time the issue was you had a non-union, your implants were getting loose, the screws were getting loose, and then ultimately your rod failed, which made it sort of a very simple diagnosis. But most of our patients with adult deformity, even if you have some sort of minor complication, still do well. So if you've had a big surgery and something's not right, you're doing lousy, the question is, look, is the surgery really okay? Is there something that needs to get fixed or repaired in there? And we see this all the time where people have been struggling with a non-union for 2 years. They come in here and we're like, well, you're not healed. Let's fix it. And usually once that's fixed, folks do well.
Right. And we don't know. We just think that that's part of the pain that comes from getting.
And that's why when we talk, about surgery with patients, we like patients to talk to other patients so they have an idea about, look, when is it time to think about doing a surgery? And more importantly, what does the average patient look like a year out from surgery? So if you're a year out from surgery and you don't sound like all the people you talk to, then wait a minute, something's wrong. Something may not be going well. You may not have healed. There may be a problem. We need to really sort of look at it. So if you're not doing well at a year, whether we did the surgery or someone else did the surgery, we take a really hard look at, hey, what's going on? This person's not doing well. We need to sort of figure out, is something else happening?
Well, I can definitely say yes. I believe 100%.
All right, videographer.